Let's take a breather and talk about a few tips that might increase your performance on the bike. It might surprise you that these tips have to do with the respiratory system. Let's take a few minutes just to define some terms so that we're all on the same page. The respiratory system is really the link from ventilation to respiration. So ventilation is the movement of air in and out of the lungs, and respiration is what happens at the cellular level. In this picture, you can sort of see a illustration of that. So we're breathing, we use that air to burn fuel, in this case a carbohydrate. The byproducts are CO2 and water, which we blow off, and we produce mechanical power. So it's the translation of chemical to mechanical energy. The respiratory system itself includes anything from the mouth and nose all the way down to the air sacs called the alveoli. It's interesting that the only place along that entire chain that air exchange actually takes place are in the alveoli. It's long been thought that the lung is overbuilt, or the respiratory system in general is overbuilt. And what that means, or why people have claimed that, is that during exercise, the max capacity of breathing reaches maybe 80% of total lung capacity. So we never completely use all the volume that our lungs have to offer. Another reason that it's claimed to be overbuilt is that there are very little adaptations in the lung tissue itself. Certainly we increase capillary density to the alveoli, but the alveoli themselves seem not to adapt much to training. So why are we talking about the respiratory system if it's overbuilt? Let's look at the graph on the left, which you're probably familiar with, at least in part. You can see terms VT1 and VT2, which stand for ventilatory threshold 1 and ventilatory threshold 2. Some of you may call those lactate turn points, all slightly different, all kind of the same. But the part that I want you to pay attention to are the lines above in blue and below in kind of the olive green. Above is tidal volume and below is breathing rate. The two of those multiplied together give you minute ventilation. Minute ventilation at rest is maybe 5 to 7 liters per minute. And with max exercise, that may go upwards of 125 liters per minute. And what I want to impress on you here is that is not, as it turns out, an insignificant amount of work. I want to highlight a study to explain this that was done beautifully and brilliantly by Dr. Jerry Dempsey in 2000 at the University of Wisconsin-Madison, probably the godfather of respiratory physiology. So he did a study in elite cyclists. He put them on an ergometer and had them work at 90% of VO2 max under 3 conditions: the control, loaded, and unloaded. And what that referred to is load on the respiratory system. So increased load, breathing through like a mesh, or unloaded, having mechanical ventilation do the work of breathing for these cyclists. And it was a pretty amazing result. In the unloaded group, so these are cyclists that are cycling at 90% VO2 max, but the work of breathing is being done for them. Their time to exhaustion increased by 14%. Conversely, the performance in the group that had loaded decreased by about as much. In the unloaded group, the VO2 at that given workload decreased. In other words, they were more economical at that power output. And finally, their sense of exertion, both dyspnea and RPE, was decreased. And so the authors speculated that in trained male cyclists, when they are working out at this high output, there is a reduction in leg blood flow that has to go to the respiratory muscles. And if you can decrease the work of breathing by unloading those muscles, performance increased. Well, obviously we can't go do our events with a ventilator attached to our top tube. So what can we do? Well, simplistically, if the work of breathing can be a limiting factor, anything that we can do to improve the work of breathing should be a performance enhancer. Things to consider: thoracic spine mobility. Most of us as cyclists lose this because our posture on the bike is somewhat protracted and rounded. So simple things like foam rolling to increase thoracic spine mobility may help decrease the work of breathing. Think about tight muscles that would restrict inhalation, like the latissimus dorsi. Fairly easy to stretch that out and possibly minimize the work of breathing. Finally, inspiratory muscle training. So like in this study, adding a load, whether it's breathing through a straw or something more sophisticated, to increase the endurance and strength of inspiratory muscles. That's it. Good luck and happy training.